I'm Annie Carter, AVP of Physician and Medical Staff Services. Thanks for joining us for the Specialty Spotlight. Today I have Dr. Cromer, Interventional Radiologist, with me. Just tell us a little bit about yourself, what Interventional Radiology is and what your role is.
Well, I am an interventional radiologist, trained in both diagnostic radiology and image-guided procedures. That specialized training comes after the residency period of diagnostic radiology. So what we've done, what we do in this field is we've harnessed the modern imaging and are using that to perform minimally invasive procedures for patients. So the role of the interventional radiologist is basically to take these modern techniques, these innovative techniques. So typically these minimally invasive image-guided procedures allow us to treat a patient in such a way that they have less pain, less time in the hospital, quicker recovery times, and just get back to their normal activities much faster.
Yeah, and I'm glad you said that. So procedures. Tell us
Right.
what some of those procedures are.
Yeah, some of the most common things that we do, include biopsies for tumors to help the oncologist derive a treatment protocol for that patient. Abscess drain catheters, and this is where we really save the patient some time in the hospital and a more speedy recovery, because we're able to, through simply a needle stick and placing a drainage catheter into an abscess cavity, using the image guidance to guide exactly, precisely where we want to go. This saves the patient from what used to be done, which is an open surgical procedure to open them up, drain it, close them back up, and that added a lot of time, in-hospital time for recovery. So we're able to do this. They're back on the road quickly. They can even leave the hospital with the drain, and then we just remove that drain at a later time. So we really get them out of the hospital quickly and back to their lives.
Yeah, that's great. So you touched on some of the most common procedures. Tell us what sets you apart from other specialties, some of the unique things that you might see or deal with.
So in addition to all of the common procedures we do, we also offer these minimally invasive image-guided techniques for such things as bleed. So we're an important component of a hospital team to take care of patients who may have a bleed from GI bleed or a bleed in their chest. Pretty much anywhere that we can get to through the road map using the arteries and veins, we can take a catheter, get there, and evaluate using the imaging whether there's an active bleed in process, and if there is an active bleed, we can stop that bleed.
So interventional radiology sounds like a specialty that's crucial for a hospital to have. Is it common? Do most places have this service line?
It is crucial to have interventional radiology as part of the hospital, in terms of that we're part of a team. We help the surgeons, we help the hospitalists all take care of their patients. So it's almost like the BASF commercial, we don't make the products you buy, we make the products you buy better. Interventional radiology is a specialized field, and many hospitals don't have interventional radiologists present. Because of that, we get many referrals here from smaller outside hospitals for that particular skill. So if a patient is having a surgical complication at an outside hospital and interventional radiology is not provided there, those patients are typically transferred here based on a phone call communication that we have with those outside providers, and then we help them in that regard. Since we are lucky enough to have interventional radiology at this hospital, not only just having interventional radiology, but we have 3 providers. We provide 24-hour, 7 days a week coverage, 365 days a year. So we are always available for patient care here at Pikeville Medical Center.
Great. So tell us what kinds of technology you may use in a surgery.
So again, interventional radiology is centered around image guidance, and all the ingenuity is around image guidance. So we harness the power of modern imaging. So we use CT, we'll use fluoroscopy or X-radiation. We'll use ultrasound when available, as that does not have radiation involved with it, and safer in that regard. We obviously review the MRIs that are performed on each patient to try to develop a safest approach to a procedure if needed, if the MR imaging is needed. So we're really harnessing all the modern imaging, and we're really blessed here at Pikeville to have most modern fluoroscopic equipment to perform 3D imaging and all sorts of reconstructions to perform the safest and most specialized targeted procedure we can.
So tell us, if somebody needs an interventional radiologist, how do they get to you? What is that referral process and what does that look like?
You know, within the hospital, we try to keep, as I said, we keep that communication open with our referring providers within the hospital. We'd like to keep them up to date on all the things that we can do and things that are coming down the pipeline. So the referral pattern from inside the hospital is pretty straightforward in that regard. We also have outreach to physicians in the community. And this way we can let them know as well kind of what we're doing and all the things that we can offer in minimally invasive procedures for their patients. So we get referrals from inside the hospital for inpatients. We get referrals from outpatients as well. Many times at an outpatient procedure, it may be a family practitioner or a smaller hospital that don't have the capabilities that we have here at Pikeville. And those patients then are referred to us. We perform the procedure. We stay in close contact with those referring providers.
Mm-hmm. I know in medicine, things are constantly changing and evolving. Are there any new things coming along, any new advancements?
There's so many exciting changes in interventional radiology. It's always changing. It's a very innovative field. So some of the things that we're really excited about are things in the realm of interventional oncology. And that's basically, we've kind of segmented that into a special area that is so growing so rapidly that it's almost becoming almost a specialty within a specialty. But some of the exciting things that are happening there is microwave ablation, which we can perform and have performed. And we're able to treat, again, very minimally invasive, a tumor in the liver by inserting a microwave antenna, basically. And we heat that and we basically cook the tumor from within, and we remove the microwave probe at the end, and the patient then has had a very minimally invasive procedure, which is basically a needle stick. We usually keep them just a single overnight stay, and what that saves them is an open procedure, a resection of that part of the liver, and usually a multi-day stay. So we get them back to work, we get them back to life right away, one day in the hospital, and they feel pretty much almost recuperated the next day.
Wow.
Other things that we're pretty excited about are for benign tumors of the uterus, we're able to, instead of the patient going in and having those surgically removed, and those benign tumors, although benign, can be painful and can cause other symptoms like urinary retention and other things. And we're able to go in and block the blood vessels in those patients to those tumors specifically. The tumors shrink, thereby the symptoms are resolved without having to go through a surgical procedure. Again, getting them back to work and back to their daily lives much quicker.
Yeah, more convenient for the patient.
So, not necessarily a new innovation, that's been around for some time, but we also perform kyphoplasty, which is a procedure that we use if someone has typically is from osteoporosis or from a fracture related to a tumor in the vertebral bodies, and they can be quite painful. So by doing this procedure, it's basically, again, 2 needle sticks advanced under image guidance, typically under fluoroscopy, and we put a balloon into that vertebral body to regain the height that was lost during the fracture, and then we put in some cement into that place where the balloon was to make sure that that vertebral body retains its height. By doing this, by elevating that vertebral body, putting in that cement, it helps incredibly with the patient's pain related to the fracture, again, in a very minimally invasive way. This is not an open neurosurgical procedure, but a minimally invasive procedure, and the patient does not even require an overnight hospital stay.
Okay.
And typically they feel the effects right away.
Mm-hmm.
They're up and they notice an effect right away after
Yeah.
the procedure.
Well, Dr. Cromer, thank you so much for joining me. It was super beneficial and educational, and maybe we'll see you again soon. And thank you so much for joining us, and see you next time on the Specialty Spotlight.